Good morning, Dr. Miller again. CoolSculpting or SmartLipo? During our body shaping consultation, one of the questions that we are asked most often is, what would be better for me? The CoolSculpting treatment or the SmartLipo procedure? CoolSculpting being this amazing fat freezing technology, still the #1 non-invasive technology in the world for long-term fat reduction. And SmartLipo, the well-known laser-assisted liposuction procedure. 4 factors need to be considered when making that decision: lifestyle, location of the collection, extent of the fat collection, and cost of the procedure, which for CoolSculpting is directly related to the extent of the collection. It has to do with the number of cycles. Now, lifestyle. If looking at SmartLipo, has to take into consideration your ability to take a few days off and to tolerate a slightly invasive procedure. Some injections, a few small incisions, and some drainage for 36 to 48 hours after the procedure. You will also need a driver on the day of the procedure, and we like for you to wear a special garment for a minimum of 3 weeks after the procedure. For CoolSculpting, no incisions, no injections. You drive yourself in and out, assuming that you have a driver's license, and you are pretty much back to your normal activities right after the treatment. Location of the collection. Some, or I should say a few areas, are not amenable to CoolSculpting treatment. Examples: a very irregular, extensive collection of the outer thighs, or the front part of a thigh collection. Now for SmartLipo, since we can customize the extent of the treatment area, there are no clear limitations or exclusions with this technology. Extent of the collection. The more limited the collection, the more we tend to favor CoolSculpting, because it is simpler and less expensive since less cycles are needed. For more extensive collection, one has to weigh in the cost efficiency of the procedure versus the ease of the procedure. Finally, cost of the procedure, which I mentioned for CoolSculpting, is directly related to the number of cycles needed, therefore to the extent and to the thickness of the collection. Let's take the abdomen as an example. If we have a small collection around the belly button, we may be able to treat that area with 2 cycles of CoolSculpting. In those cases, CoolSculpting will be our preferred method. Cost-wise, it is a little less than half the cost of a SmartLipo procedure. Now, if we have a collection that extends from the pubic area all the way up to the rib cage, one would be looking at probably 6 cycles of CoolSculpting, which is approximately the cost of a SmartLipo procedure. In addition, if that collection is very thick, and here we're talking very extensive collection, we may need to treat that area with 2 rounds of CoolSculpting, i.e. 12 cycles. In such cases, unless money is no object, we would tend to recommend a SmartLipo procedure. On the other hand, for very localized collections of the inner thighs, or of the brow roll, where we would need probably only 2 cycles of CoolSculpting, then CoolSculpting becomes obviously our preferred method of treatment. In fact, we see several patients in our practice with those localized collections. And for those patients, my typical recommendation goes as follows. Option number 1, CoolSculpting. Option number 2, CoolSculpting. And option number 3, CoolSculpting. On this note, enjoy the rest of the weekend. Thank you.